the tissue is usually really nice and warmed up and ready to go. And I always like to just do effleurage in between everything. Lots of effleurage. Alright, so now we are ready for friction. So again, effleurage. And friction can go both ways. It can go up or down on the back since you aren't worried about the extremities and pushing away from the heart. So I'm going to start with my friction down at the sacrum here. Just get a little bit more cream. Okay. So your SI joint is in here. And it's a tender area for some people, so you just want to make sure when you're doing your friction that you're using a good pressure for them. So I like to slide my forearm in until I'm at the erector, and then I will slowly go up. How is that pressure?
That's good.
Okay. Now I'm not on the spine, I'm on the erector spinae muscles, which are right next to the spine. And you go pretty slow, especially at first. Tender there.
Mm-hmm.
And about here you can go just a little deeper if they're comfortable with it. Does that feel okay?
Yeah.
And then when I get up here, I'll veer towards the upper trap and go past the neck. I'm gonna come down like this, and my hand follows. And I'm gonna use a little bit more cream. Usually you have to use more once you introduce your forearm, just because it starts taking some of it. And then I effleurage, kind of like my make nice. And now I'm gonna do a friction stroke down. So I'm gonna switch elbows. So when you're moving this way, you're using this arm, and when you move this way, you use this arm. So I'm gonna come in here, I'm gonna tuck underneath the upper trap here, and I'm gonna slide past it. Is that pressure still okay?
Mm-hmm.
And I'm adding a little vibration in here because it's tight. So up here it can handle a lot more pressure. In the middle here, this is where people get pretty tender. They also, some people will have a spasm in here, especially if they don't get a lot of body work. Does your body do that?
I'm sensitive.
Okay. By the end of school, you'll be less sensitive. Not by choice. No, I'm just kidding. But if something's kicking you off, like you're trying to ride it down, then you're using too much pressure and you need to back up a little bit and you need to go super slow. When they're spasming like that, they cannot help it. It's just their body's protecting them. So if they are spasming, then you're probably using too much pressure. So that's just something to keep in mind. Some people are crazy and they love it when their muscles kick you off. Like they love that. So those crazy deep people and you're like doing this move and they want deeper and their body's like kicking you out. To you, it's like counterintuitive because they're not relaxing, but to their little brains, they're like, this is amazing. She's crushing me. So
when we were doing the back of the leg, or in the calf area, as we were doing friction up or down, and we got kicked off or it just rolled, is that just because we were doing it too tight then in that case?
Too deep, yeah.
Too deep, okay.
Yeah. And when I get to the sacrum, I'm gonna bring and ride the iliac crest all the way out. Is that pressure still okay?
Yes.
Is it too much?
That's a little too. Yeah, that's good.
Is that better?
Yes.
People are really sensitive in here, so you just want to make sure you don't go too deep. Some people love it when you stab it into their low back, so that's, everyone's different. So just check in, especially as you're learning your strength. So yeah, you can ride the erectors a couple times, and as you go, you can also use your fingertips if they're really tender or they keep kicking you off. You can just use the tips of your fingers, and I use vibration.